Good evening, everyone. So grateful that you're able to join us for our third installment of And Faith. This has been a good 3 weeks so far that we've been able to explore pressing current life issues and think about them at the intersection of our faith. We talked about police justice our first week in faith. The second week we talked about vaccinations, the vaccine, particularly COVID-19 vaccine and faith. And tonight, we are to talk about. We're privileged to be joined by Dr. Bettis. Is it Doctor? I always say that.
Not
I have
yet.
this
I'm on my way.
inspiration
I'm
always.
on my way. But you can prophesize. I listen.
Yo, I'm
Coming.
for that. I'm for that. Dr. Bettis has been with us on a number of occasions. She was with us last year around this time when we were doing our Beloved TV, and she helped us think through our mental health and when we were really at the beginning of this pandemic, and now we are inching toward a new phase, a new moment in COVID reality. Some may think it's the end, and we are entitled to believe that. But really adjusting to what it means to live with COVID-19 among us, and try to figure out how we establish new normals, how we establish temporary normals, how we live with a certain type of fluidity and live with adaptability as we make sense of what our lives will be like and how productive they can be now that the world is opening up to some extent. And so we are privileged tonight to have some conversation around therapy and faith, to have some conversation around therapy and faith. And I think this is particularly important because there's so many stigmas around what it means to pursue mental health care. There's so many stigmas, particularly that have been embedded in the faith that cause us to retreat from these sort of life-saving resources that Dr. Bettis provides to various families in our community. She is a clinical social worker, but she is also a licensed therapist, deeply credentialed, but also a woman of faith. And I think she is one of the best persons to help us think through this intersection, to help us think through the necessity of carrying our faith along with other avenues of mental and emotional health care. So, Dr. Bettis, I said what I could say. Hope we set this up, and we're with you now. So, however you want to lead us, we are in your hands, and then we'll open it up for some conversation after you have blessed us with your wisdom and expertise.
Well, thank you again, Pastor Francois, for having me again. Thank you to the whole congregation of Mount Zion Baptist Church for trusting me with such an important topic. And as stated, the pandemic. Many of us are living in this idea is that we can take our mask off now. We can go back into our offices. We can go back into our brick and mortars. We can go into the store and we can have our masks on or not on. What does that really mean? Does that mean that the anxiety is gone? Does that mean that fear is not there? Does that mean that people are not still skeptical? Does that mean now we are entrusting our health and our hope into people that we do not know, assuming that everyone is vaccinated? What does that mean? So here's uncertainty. We all know that uncertainty is the root of anxiety, right? The fear of the unknown. At this point in time, many of us have experienced grief and loss. Many of us have experienced job loss. Many of us have experienced transitions in our relationships and in our occupations. Many of us, our children, have now been virtually schooled for almost a year, which caused many of us to have double duties throughout the day. We had to manage our homes. We had to manage our, work with our relationships to keep them nurtured. And we had to become online instructors. Now, is everything from the pandemic a negative when we do a little bit of reflection? No. Many of you have started your own businesses. Many of you have went back to school. Many relationships have flourished because in 2019, the divorce rate had actually went up really, really high. 2020 displayed that people were working harder to manage their relationships because now they were forced to be in the same space, and they had to make those spaces worth it and make it work and use that time wisely. So when I talk about mental health and I think about faith, I've had this conversation several times in a similar setting. Does it mean that if you're a Christian or a believer, that you cannot seek mental health counseling, or you cannot watch documentaries on mental health, or something on Netflix that may have a mental health undertone or behavioral health undertone? That is not what that means. That is not what that means. As a mental health provider, a lot of times people will call me for a consult and say, "Are you a Christian counselor?" And I will say, "No, I am not. I am not certified as a Christian counselor." And then if they continue to call me back, I will have conversations with them about what is it that you need in a counselor, and what does it mean? What does the Christian piece mean to you? What does that mean? What does a person have or have to know or have to believe or feel in order to help you manage your depression, your attachment issues, your lack of support, of feeling supported, your anxiety, your sleeplessness, your dysfunctional eating, whatever the challenge is. I have those conversations with people who are open to having those conversations. Now, ethically, I'm taught that we don't mix religion and our mental health practice. But I am a believer, and I don't hide the fact that I'm a believer. But I do believe, and I also believe that these earthly elements that we go through, the anxiety, depression, the self-doubt, the low self-esteem, the fear, all of these elements that some of us experience, they need to be dealt with here, or for people that are tangible, people you can see. But that doesn't mean you don't believe. It doesn't mean that. Now, it's also a generational perspective, right? I know my generation, more of us are saying, we're going to therapy. I'm going to therapy. I'm going to see. We go to therapists like we go to any other appointment. But what I'm starting to see is the younger generations also saying, I'm embracing my mental health or my mental hygiene, and I'm going to go into counseling. I'm going into counseling. I'm not ashamed. I'm not embarrassed. And many of the people are also believers. So what does this mean when we try to link this all together? When we first went into the pandemic, everyone was all over the place. We were all over the place mentally, socially, professionally. Now we're starting to, I don't want to say adapt, but I guess the right word would be adapt. We are adapting to these post-pandemic conditions. What does that mean for our faith? Well, like I said in the beginning, many of us have lost loved ones. Many of us have lost resources and different things that we valued during this time. So does that mean that do you think that maybe someone or other people may have start slimming down in their faith and believe in their belief? I think so. A lot of times I work with clients who come and say, I'm angry and I'm mad at God for different reasons. And I asked them, I said, well, let's talk about this a little bit, because the first thing we have to do is validate people with their feelings, no matter what their feeling is. No, not even if you don't agree with what they're feeling or what they're stating, it's still important to provide validation, because when you don't validate people, then you send them back down the spiral. Now they don't even feel like what they're thinking is appropriate, or what they're thinking is meaningful to them, because they can't get someone to validate them. So validation is a huge part of the healing process. And right now, honestly, no matter how you've been affected by COVID-19, even if you haven't been affected by COVID-19 in any way, we're still all in a healing process here. It was traumatic. I know for me, in my lifetime, it was the first time that I lived through a pandemic and survived the pandemic. And being a COVID survivor, I think that it's different for me. I was diagnosed with COVID before, and it was troubling for me. Just the mental component. Physically, I felt okay, but mentally, I couldn't seem to find a good space to sit with it. So even for me as a clinician, it definitely impacted my mental and emotional health. So going back to thinking about, like I said, what does this all mean? This means that people are putting themselves back together again. And one of the big, big ideas that I spoke about when I think about the church community. People who were used to getting up at least twice a week, Wednesday after work, cooking dinner, going to Bible study. Sometimes Tuesdays choir rehearsal. Then church on Sunday. Sometimes two services. That was a lifestyle that many people have gotten accustomed to. We had to stop that. People had to start attending church online. A lot of our older, citizens in the community, they could not get used to that. Now I have to sign on to a computer and I have to wait for someone to let me in church and let me into the service. I can't see the musicians. I can't see the people singing. Just the sense of community that brought to some people's life, being able to go to church and fellowship with other people, be in the presence of God. That really struck a lot of people hard. And it also laid a foundation for depression and sadness. Now, I had stated in another forum that I don't like to use the word depression outside of the clinical setting. I like to use the word heaviness. And heaviness is a combination of isolation, sadness, uncertainty, low mood, somberness. But it also can lead to low frustration tolerance, irritability. So the trajectory of mental health challenges that we saw on as a whole in the mental health community associated with the church communities, no matter what the faith was, we saw a serious influx of mental health conditions, and mental health diagnoses, and mental health treatment. Now, some people may say, I keep hearing the same thing. Everyone that, experienced the pandemic did not necessarily leave their church or get angry with God. And that's true. That's true. Sometimes I know for me, I was able to attend church services online, and I was also able to benefit from the church services that other people were sharing online. So I was able to get a whole lot of support and information. I was able to read books. I was able to do different things to increase my level of spirituality. But at the same time, I was treating people with mental health conditions. So it definitely had to be a didactic process for me. Because like I said, through the loss, that whether it was death, people moving, people losing different things, people loss of relationship, I still had to be that person to manage that grief for other people. So let's talk about coping. Let's talk about coping. Now, coping strategies during the pandemic, we were a little bit limited, but we also had some fluid, right? Netflix, we had visual prompts. People started, different businesses. People were shopping online. More people were reading. Like I said, people were going back to school. Some universities were offering free academic courses for people. So was there some benefits? Absolutely. Absolutely. And a lot of people prioritized and capitalized off of these opportunities. A lot of people I know went back to school and got certificates. A lot of people I know started school again. A lot of people I know started broadcasts like this, on a weekly basis or a monthly basis where they would have different professionals from different genres of work of professions come in and talk about things. So yes, we were able to network more. We were able to network more. But what does this mean now when restaurants are back open in full capacity? Movie theaters are open. You don't have to wear your mask in different places now. Did our take two skills change? Are we still needing that time to cope? Are we still as attentive to ourselves now that we feel we're getting some normalcy? So when you talk about coping strategies, I can think of several that we used while we were, confined to our homes. But now we're no longer confined to our homes. So will those coping strategies be adaptive or maladaptive? These are the things we have to think about. Outside of, like I said, that routine Wednesday night Bible study, which was done online. A lot of us didn't lose that, right? We still have access to that. The spiritual community in this area did an amazing job of connecting people and bringing people into the fold. Because you know why? because they had the ability to do so. Technology has allowed that. But like I said, now we're open. We're open again, right? So now people are out. What is this going to do to the people? Going to still be willing to sign on, on Sunday morning, or they say no, we're ready to go back into church full capacity, and a lot of people are doing that now. But what are they coming with? What are they coming? What are the remnants? What are the remnants of the pandemic that we're still in? I mean, me personally, I feel like we're still kind of living under the same. We don't have all the restrictions, but that doesn't change the mental challenges that comes with that. Me going into Wawa this morning and someone not having on a mask, and I had on a mask as a fully vaccinated person. So for me, did that bring some? Yeah, that was a little anxiety driving for me. So what does this mean? How am I coping with these things? Are there people for me to talk to? Are there people for you to talk to? Is your place of faith, are they having support groups to talk about people who may still be within the grief process of losing a loved one during the pandemic? The one thing about coping is that it needs to be a consistent process, and everyone copes differently. So how are we supporting each other? Not only in the church community, but just in the communities outside of the churches. Are we still being as generous? Are we still offering waters and food gift cards and open pantries to people in the community that may still be trying to cope with such loss in these post pandemic conditions? What are we doing about that? Are we still feeling overwhelmed? Are we burnt out? Are we deflated? Are we spiritually fatigued? Are we mentally fatigued? So when you talk about faith and therapy, there's there's so much potential burnout there. And how are you taking care of yourself? How are your churches taking care of each other? Do you have mental health staff? I mean, in your congregation that are offering baseline psychoeducational support groups to your members as needed? Is there a help box where someone could put their information confidentially in a slot and or in a box or in a mailbox, and someone will call them and check on them just to make sure that they're okay, even if they just need an ear? So when I say coping, the coping that we exercise during the pandemic needs to really, look similar to what we're doing right now outside of these post-pandemic, and within these post-pandemic conditions. So that's just a question that I have. And I'm even going to write that down because I think that that's another very important point to make, is that are we just free? Do we just become nonchalant about it? Because now we can pull up back in our churches, and now we can go to have dinner and see a concert, or because we now can walk around and have these, gatherings that with no limitations, have people, do they have more faith now than they had because now they have the vaccine? Are they putting all their faith in the vaccine and not, and coming outside of their spiritual connections? If people's spiritual connections change because relationships were broken down, because now you're not in church fellowshipping with that church member anymore. So you're just pretty much like, okay, whatever, I can, I don't need to do that anymore. And how is that affecting your social and mental health? So these are very, very important points. What does life look like now, post these so-called post-pandemic conditions that we're living in, from a spiritual perspective, from a mental health perspective, from an emotional perspective, from a social perspective, and from a professional perspective? All these things align together, right? So I think that it's very important, and I'm really, really appreciative of all the different church, the church leaders for pulling these type of forums together. I think that in May I might have did about 6 or 7 speaking engagements, because I think that people really value mental health now, and I'm really, really excited about the way the spiritual community is embracing the concept of mental health, because it is important. And, it shouldn't be necessarily looked at as two separate entities. Because many times people who are struggling with their spirituality experience mental health symptoms, lack of confidence, lack of self-esteem. They don't know how to separate the two. Sometimes they can't separate, because I haven't been as dedicated in my church. Does that mean there's something wrong with me, even though they're struggling to get up in the morning to go to work because they're depressed, or they're fearful, or they're anxious, or they're worried, or they experiencing self-doubt, lack of self-efficacy. But they don't have, but they show up on Wednesday on a Zoom for Bible study, or they show up at the meetings, or they show up on Sunday, but they don't know how to talk about it. They don't know who to talk to. They don't know who to tell. Well, I overslept because my mind was racing all night long and I couldn't sleep, and I didn't know how or what to say in my prayer. So I didn't know how to solicit or elicit help from God. And I don't know how to elicit help from my church family. These need to be open, fluid conversations at all time. And people shouldn't feel that if they bring it up, that they're going to be stigmatized and looked at, or they just need to go pray. I remember as a teenager, that was what I was told all the time prior to being diagnosed with clinical depression. I remember that. I remember that. That was old school. That was old school. But at the same time, my campaign has been a little bit of therapy and a whole lot of Jesus has never hurt anyone. That's my personal feeling to, in forums like this. That it's okay to be spiritual and have a spiritual foundation, but also make that phone call to talk to someone who can offer you a professional but objective viewpoint on what you're experiencing, because mental health affects every aspect of your life. It affects how you function on your job. It affects how you function within your relationships. It affects how you function within your home. It affects how you function within your civic organizations. And it affects the way you function in your church. And I know a lot of people may not believe that, but there's some truth to that. And this is all psychoeducation purposeful that I'm saying right now, but it is important. It is important. And I do invest in literature that discuss the importance of people within the spiritual fold to understand that in the human sense, validation and understanding of mental health challenges and mental health um, coping strategies and mental health recognition, and exploring things that do not allow you to function as your best self from day to day. That is important. Also, there's literature that talks about people that are healing from abuse and different other type of trauma and traumatic life situations. How important it is for them, if they do have a spiritual background, to go and foundation to dig into that and merge the two. Learn the coping abilities, learn the chill skills, learn the coping skills. Also value what it says in the word and and it helps you manage. So it's a nice mixture. It's a nice culmination of skills to have and a foundation to support you on the external and in the internal parts of your life. And I think that that's very important. And I appreciate this. I appreciate this space speak on this because it is very, very important to, always be intact with your mental health, your mental functioning, how you're coping from day to day life experiences. If you're not able to cope with them, if you're not able to recognize them and explore the differences that you may be experiencing on both a cognitive and physical level, these things are important. And I think that the drive home point is just as supportive as the church community has been during was during the pandemic. It's just as important to be as supportive, if not even more, now, because now people are gonna like sit down and process, wow, what we're going through, and now, like Pastor Francois said, Now I have to get used to some new norms. Now I have to get used to some new attitudes and new behaviors. And now I can actually be out in the world experiencing these transitions and changes. And then now we're going back into our churches, we're going back into our regular spiritual routines. What am I bringing back into the church? What am I bringing back in? Is this going to be helpful to my church family? Is this going to be helpful for me to grow spiritually? Is it going to be helpful? So it's really important to explore both components of that dyad. It's very important, very important. So I definitely appreciate the space tonight, and I'm hoping people have questions, and hopefully I have answers for you.
Good. Thank you so much for really taking that time to unpack the kind of complicatedness, the complexity of where we are, the complexity of what we are experiencing, and what we will continue to experience over these next months, several
Mm-hmm.
months of recovery, and these next several
Mm-hmm.
months of norm setting and norm adjusting. I'm wondering, can you, and please, if you have questions, you put them in the chat. I promise to get to as many of them as possible before our 7:45 deadline, 7:45 departure. But can you give us maybe some top line obvious benefits of receiving therapy, of pursuing therapy? Why should we do it?
Therapy I look at it as an intimate process, a time where you can deal with all different parts of you. I think it's an exploration process as well. It's very beneficial to get to know you. We take a lot of time and we put a lot of investment in other people, but we tend to deprive ourselves of that when it comes to us. You know, but I mean, I'm from this area, right? And I really, really have a passion for people of color, right? So I have a passion for people, but I really, really have a passion for people of color. And all when we start thinking about we've been told or that we've developed for ourselves, whether they be true or not, it's what we've told ourselves. And the benefit of therapy is being able to sit down and explore some of those cognitive thoughts, whether they're distortions or if it's cognitive dissonance, if it's a power struggle between you and your thoughts or you and your beliefs. It's an opportunity to process and practice thought stopping. It's an opportunity to explore automatic thoughts that control behaviors from day to day, be them negative or positive behaviors, adaptive or maladaptive behaviors. And not only that, it provides you with an opportunity to speak to someone who is objective and they don't have a judgment and they don't have a perspective or a perception of you. So there's a lot of different benefits to therapy. But the downside is entering into the therapeutic process before you know you're ready. Because the therapeutic process not only helps you explore those strengths that you have, sometimes there's some behaviors that we engage in, whether it be faulty thinking, repetitive relationship patterns that aren't beneficial for us, negative thinking, overthinking, underthinking, all of these different behaviors that are many of us, including myself, I'm speaking to me first, engage in that we might have to be called out upon. But you know what? Once you bring it to the surface, it allows you time to process and fix. Once it's fixed, it's finished. Once it's fixed, it's finished. You don't have to go back there again. So there's multiple benefits to seeking psychotherapy.
I'm curious if you can just help us think through what are some of those dominant narratives, those dominant thoughts that actually get in the way of our healthiness, our mental healthiness.
It's me. I'm flawed. My parents were flawed. This will never change. I deserve this treatment. I'm a bad person because of my past is who I am. I will never be anything different. I'm not worthy of change or transition. I can't do it. It's not possible to do it. I failed before, I'll fail again. All of these negative thoughts that we feed ourselves, because what happens with life is you can wake up one morning and you could have been wrestling with a thought all night about something on your job. And when you get up and go to work that morning, you're going to get out your car, you're going to grab your coffee. Me, I'm a Wawa coffee sometimes, Dunkin'. You're going to grab your coffee, and something's going to occur in that day that's going to try to validate that same negative thought that you've been wrestling with about your job, and you are going to internalize it. You're not going to think about it in the context of which it occurs. You're going to automatically say, I knew that this job wasn't for me, or these people didn't like me here because they didn't invite me to the meeting that they had, and I bet you they were talking about me. So life has a way of making you believe that some of the thoughts that you have are accurate. And not only that, it has a way of making you think that it's because of you, when many of the things that we experience on a daily basis are not because of us. They're not all self-inflicted. It could be because of something that's totally unrelated to another person, or totally unrelated to anything or any setting that you may be in. But because it occurs, and it brings you validation, and because you're in a space that you cannot defer from the thought that you have, because if you think something long enough, it becomes true to you. And you will find ways, and your environment will find ways to say to you, mm-hmm, I told you it was you. I told you you wouldn't get that promotion. I told you you would never be in love. I told you you would never be loved. I told you you weren't good enough. I told you not to even try. So these are some of the cognitive distortions that we deal with from day to day, whether they be generational, whether they be perpetual, whether they be situational or episodic. These are the negative narrative thematic patterns that we have formed, that have been dawned on us, that we have to work through faith and therapy to destroy. Now you took me down that road, and that got me over here like, how about that thought I had earlier? How about
Mhm.
that?
I mean, and they come. So I think you call them those automatic thoughts. Those are the
Automatic.
things you don't have to drum up. Those are the things that aren't necessarily triggered by don't necessarily have to be triggered by what's going
Mhm.
on right now. It seems like we carry those narratives with us, and we have to find ways to combat them, to address them. We have to really figure out what does it mean to come up with some new psychological and emotional armor that really helps to treat those places in us that we are so fearful of going. And our fear of going into those places, attending to those places, are often what allows those thoughts to flourish,
Mhm.
instead of allowing uh, something more true to flourish. Why do you think we are so inclined to feed those distortions of reality instead of finding those alternatives that are sometimes louder, that are sometimes more clear? Why is it that we dwell on the negative when there is so much positive that's just looming around us?
Because the negative is a familiar place.
Mm,
The negative is familiar, and we fear disappointment. We
mm,
fear rejection. If I tell myself every day that I'm going to get that promotion because I worked hard, I went to school, I have the credentials, I have the support of my family, but then I go to work and that position is not given to me, then that feeds all the negative thoughts that I had anyway. Because it's more common to go towards the negative. Now, positive thinking within itself is a skill. It's a skill. I've had 6 people say to me today, well, think positive. And I'm thinking to myself, well, think positive with everything that I was told. And I'm thinking, okay, I got it. But that's a skill within itself. It's not easy to switch that. from the negative, because the negative is what most of us have been used to. You know, a lot of us have experienced different levels of disappointment in life, people, places, and things. If you've had one relationship in your life and you haven't been disappointed, then I say, you know what, I honor you. You know, if you've had any experience in your life where no one ever let you down, then I honor you, because that, you know, let down, disappointment, frustration, you know, rejection, that's a part of life. So it's easier to go to the disappointment because then you don't feel as traumatized when you get that expected outcome. And a lot of times it's hard to think different and positive, because what does that change look like? Are you even ready for that positive shift? Are you even ready for that shift? Do you even know how to deal with it? And are you ready to make the mindset shift that you need to make to live within that positive outcome that you never thought was coming in the first place? So it's a shifting process. And I think that many of us were scared to shift, because what does it look like? Am I prepared to live within that positivity?
Mm.
Or will I ruin it? Or will I, here's the word, will I sabotage myself?
Mm-hmm.
Because all my life experiences before this have told me that I am not good enough, that I
Mm-hmm.
need to be just prepared to just be set up for to be set up for the setup, because this is all I'm getting is negative. So if I change my mind, how do I prepare myself spiritually, physically, mentally, and emotionally to walk within a level of positivity and stay in that mindset? It's a difficult shift to make.
Mm-hmm. How so often, and I'm going to make a shift just slightly. It's so often, you know, I run into people who
Mhm,
um, I call it the underthinking of spiritual thinking is
mhm,
that sometimes we over spiritualize life, that we underthink like the real implications of non-action. The real implications of allowing these negative thoughts, these automatic thoughts to flourish. And we do it as in this kind of pursuit for righteousness, as a way of achieving religious nobility. That in
mhm,
order for me to live out the dignity of my faith, I can't go to therapy. In order for me to live out the dignity of my faith, I can't get a vaccine, which I've heard recently.
mhm.
You know, folks say, you know, I'm not going to get the vaccine because I'm saved, right? And
Right.
I hear people say, I don't need therapy because I have faith, right? They see the two in diametric opposition. So,
Mhm,
do you have a standard response that you give to people who say, you know, obviously these aren't people who come to you
mhm,
because they won't come to you because of this kind of block, these
mhm,
roadblocks that are created. But do
mhm.
you have a standard response for folk who say, I don't need therapy because I'm saved. I don't need therapy because I have faith. I don't need therapy because I pray. Though, how do we talk to people about the benefits? I've been in therapy for years. How do we talk to people about the benefits of therapy without us feeling like we're being too paternalistic, or feel like we are judging those who don't want therapy? How do we healthily talk to people about the benefits of therapy when they live with that kind of position? I don't need it. I have faith.
So what I think I had spoke to earlier about the importance of balance, spiritual balance, and you know, earthly, like, I mean, here on earth, we are dealing with some things. And what I had a conversation with someone outside of a clinical setting. I was saying to myself, you know, when you read the stories in the Bible, there's nothing new under the sun, right? A lot of things that people experience in the Bible, a lot of us are experiencing today: insecurity, you know, uncertainty, low self-esteem, heaviness, worry, fear of judgment, you know, lack of self-efficacy. I always say, I had said to the person I was talking to, and I always said this before, you know, just like, you know, God has said this, I want this person to be a surgeon, to do heart surgery, because people are going to need this to save their life. Or I'm setting this person aside because I want them to pastor a church and lead my people. It's the same with clinicians. And I'm not saying that, you know, therapists, you know, I'm not making any implication that, you know, God has said, okay, these people can be therapists, but he gave people the wisdom to talk about the mind and talk about these emotions and the ailments and the things that psychoanalytic, psychodynamic factors that plague us as people here on earth as we try to live as best as we can. And I say to them, just like when you feel unsure or you feel scared about something in life, you pull your Bible. You go to your Bible and you look for that scripture on fear or how not to fear. We do the same thing as clinicians. If we're dealing and treating someone with anxiety, we have a book, we have a playbook that we have to use, and we have skills that we can give people to use here on this earth. And it does not mean that they don't show up for church on Sunday. It's a nice balance. And sometimes people have to explore that balance. But I also say to them, go back to your word and see what it says. See what was the purpose of the leaders? What was the insight that they were giving the people to support them to make it through day-to-day life? So a balance of both is really good and it's healthy and it can be healthy.
Can you and we're wrapping up, but sometimes I'm concerned about the imprecise, sometimes dangerous language that we can use around mental health, that we can use related to mental health issues, mental health phenomena, like calling people crazy, saying people are touched, the ways that we sort of trivialize people's dysfunctional behavior without trivializing it, but also denigrating it in some ways. What do we need to do with our language? How should we talk about mental health episodes? How should we talk about family members who are struggling with particular particular ruptures from reality, particular breaks from reality? How do we talk about our cousins and uncles that we know are having mental health challenges in ways that are humanizing, but also ways that normalize the pursuit of mental health care?
It's about acceptance. It's about acceptance. And when you say rupture from reality, that becomes their reality. When you get into a depressive state or a state outside of your normal level of functioning, that becomes your reality. That is their reality at that time. That is the reality. And I think that as people, we just have to learn how to validate, say, you know what? I'm here with you. I'm going to stay in this space with you. Let's get you someone that can help you. And I think that, like I said, the verbiage is like generational. That didn't just, we talk about a people that have been so marginalized and oppressed and so damaged on so many levels. And then to think that we are in this day and time, 2021, where we're still using words like crazy and touched. When we talk about, people who are, struggling to manage their emotional health from day to day, it becomes a suppressive process. It's oppressive. It's oppressive. It's a very oppressive process. And I think that we have to be mindful of the words and verbiage that we use when we're addressing and when if you don't know what to say, then look for someone who does. Because sometimes you do more damage to that person by not being able to validate them and support them in that space. So we definitely have to be mindful of the terms that we use and the verbiage that we use, and we need to be more supportive. It's not, we need to move away from the judgment phase and in the judgment stance and take a more supportive stance towards people and help people find people that can support them and have a better level of understanding. Because also sometimes, I don't think people do it intentionally, but I think that it's hurtful and it's scary when you see your family member changing or going through a shift that they may not understand and that you may not understand.
I think this will be one of the last points. One of our members just put in the chat, just talking about the processional nature of mental health, mental healing, emotional. That there are people who, the same way people say, "Oh, you've been going to church all those years and you still struggle." See, ABC. How should we think about mental and psychological healing. How do we honor it as a process and not an event? How do we talk about it as something that is ongoing, and not something that is sort of once and done? I think that may be an over reduction, but something that has a built-in deadline to it. How
Okay.
do you help people understand that this may actually be a lifelong process?
I have to tell you, and I said this about 2 years ago when I went on a radio show with another respected man of God in this area. It's time to start implementing mental health ministries in our churches. It's
Amen.
time. It's time. It's time. It should not be something that's outside or set apart. We have to embrace it. Just like if if one of your parishioners come to you and say, Pastor Francois, I need to meet with the trust or the prayer group because I've been diagnosed with cancer. First thing that people are going to do is say, "Oh, I'm so sorry to hear that. We're going to pray. We're going to have prayer. We're going to have special prayer of healing for you." The process should be no different to an individual that is suffering from mental health challenges or mental health, event. There should be no separation. It's just as prominent as a medical disorder. And I'm not speaking to I'm not minimizing the impact of cancer. God knows I'm not doing that, especially right now in this season that I'm in. I'm not minimizing that. But I am saying that we have to become more open and embrace mental illness, especially in communities of color. Mental health is more important in communities of color because there is the stigma attached, and then there is the fear. The stigma is not coming from the people who are outside of our communities. The stigma comes from the people within our communities. The stigma, we have to make the stigma not getting help. That needs to be the stigma, not getting help and embracing it. Our mental health. That shouldn't be the stigma. The stigma should be when you don't go for help or when you don't accept people and embrace them and treat them under a community of healing that you would under any other, treatment issue. We have to make it normal. We have to normalize this.
Mm-hmm.
Normalize this, not make it something outside of our spiritual communities. It needs to be normalized. I know when I was little, I remember going to church and the nurse, they had and I know your church is fake. They have a nursing ministry. You got nurses in the church. If somebody starts to feel ill, the nurses are there, right? It's no different. Have a community of mental health professionals or train your members in mental health first aid so that you have these people on standby so that your people can come and be fully fed. When you talk about feeding a person, their emotional and mental health is just as important as giving them food to nurture their bodies.
Yeah.
It's the same thing.
Yeah.
We are not outside of mental health. Mental health is a part of us. We have to make it a natural, normalized part of our communities and our schools and our churches and our fraternities and our sororities. Everybody has done something on mental health. Every sorority, fraternity, civic organization has done something on mental health. It's not outside of us. It is a part of us.
Yeah.
And it's worse with us because it's generational, it's pervasive. But what has hurt us is that we want to make it something on the outside. We need to embrace it and become one with it in every way.
Wow. No, that's extraordinarily helpful, and it's directive. I think one of the strategic priorities that I've introduced this year is establishing a mental health center at our church.
Nice.
We've been in conversation with folks at Atlantic Care. We have some
Nice.
other conversations we want to have with folk in the county about what does it mean to offer free mental health care
Mm-hmm.
services, not just to our
Mm-hmm.
congregation. We know our
Mm-hmm.
congregation really can benefit from it, but to the vast majority of folk who are in our county who are suffering in silence.
Mm-hmm.
Who are literally living behind masks that are killing them.
Mhm.
folk who are who are being driven to these unhealthy coping mechanisms. And one of the stats that has been alarming for me is just the disparity.
Mhm.
One, between the racial disparity between
Mhm.
mental health care needs and
Mhm.
mental health care access, but
Mhm.
also just the vast difference between the ratio between how many
Yep.
mental health care professionals we have
Yep.
and the number of people. I think that the numbers were 700 plus to one in our county, and
Mhm.
that's alarming. That's unmanageable. That's unsustainable. And so we as a congregation are we know we can play a significant role
Mhm.
in bridging this gap in humanizing mental health conditions, but also normalizing mental health care. And so we're grateful for folk like you, who you've been with us on multiple occasions during the pandemic, and we know that as we are moving into this normal, that we hope to continue this relationship with
Absolutely.
you, and you've been a significant blessing to us tonight, and we trust and we know that you're gonna be a blessing everywhere you stand up, everywhere
Thank
you
you.
show up. So thank you for
Thank
for
you.
being with us tonight. If nothing else, I hope everybody heard that positive thinking is a discipline. It's a skill. And I think that really unlocked a lot of us to know that positivity is not as automatic, it's not as familiar as the negativity where we've been forced to live by so many realities, whether structural or whether interpersonal, or whether sort of self-inflicted, self-sabotaging reality. So thank you again
Thank
for
you.
being with us tonight. If there's a final word you want to give, I'll let you say that, and then we'll pray.
I'm going to say two things, and I'm never lost for words, but I'm going to just say these two. Normalize and positive thinking is a skill and should not be an expectant. It is a
Mm,
skill. And if you practice it and make it contagious, we will all have some different outcomes.
wow. Powerful. Well, we have been blessed tonight by Dr. Bettis, and we have a lot of homework to do as we pursue wholeness, as we make flourishing a priority, and we make mental health care and mental healthiness a priority, a part of our repertoire and skill set on a daily basis. So we'll be back right here. Next week, we'll be back here right here for another installment of And Faith. Have a wonderful brother coming to be in dialogue with us, and from Chicago. And so I hope that you will invite somebody to share with us as we shift a little bit to think about the political, in some ways, the political and faith, but it's going to be a rich conversation and a rich contribution to our faith lives. We will see you on Sunday. Let's remember that our women's ministry has an event this week. It has an event this weekend, Saturday at 10 o'clock. Our women's ministry has done a significant job of making sure that we have a wonderful diet that's allowing us to process life this week. This Saturday, from 1 p.m. to 2:15, there'll be an event called transitioning from reaction to action.
Mm.
Transitioning from reaction to action. Got 3 speakers that are going to be with us, and I know it's going to be helpful not just for the sisters, but we hope all the sisters will join us. But it's going to be extraordinarily helpful. We'll have that experience on Zoom, and then Sunday we will be celebrating 115 years as a congregation. Our 115th church anniversary, and the Reverend Dr. The pastor, Michael A. Warren of the of the First Corinthian Baptist Church, FCBC, in Harlem, New York, will be with us. So we're looking forward to Pastor Mike sharing with us, bringing some of that FCBC power, FCBC wisdom to us. So I hope that you all will all be logged in and ready to worship on Sunday. Thanks for everybody that came out for our first in-person experience this last week. What a time that was! Our first in-person indoor experience. What a time that was! It looked like so many of us were benefited greatly by being back together. This week we're back in our virtual mode, so we won't be in the building, but we will be back in virtual mode celebrating 115 years. And Pastor Mike of FCBC will be with us as we say happy 115th birthday to this awesome church that God has given us and has allowed us to live in, to be served by, but also to serve through. And so until we meet again on Saturday, then again on Sunday, may the Lord bless you and keep you. Now unto you, O God, who's able to do exceedingly abundantly above all we could ask or think, according to the power at work in us. To you, God, be glory, majesty, dominion, and power today and forevermore. And everybody everywhere said, amen. You all have a blessed night. I look forward to sharing with you all virtually on Saturday and on Sunday. Peace.